didn't feel good, and they said, "You have diabetes." And that was something that just hurt. I had no hope that there would be life without diabetes. Last August, my A1C was 15. Pretty bad. A few months ago, it was 11. And has brought it down to 7.6. So, these are tears of joy. I'm sorry, I'm crying, but I feel like it's a miracle. Diabetes, it takes away all the things that you want to do. Now, I can walk. I can run if I wanted to. I can climb up on things without fear of falling. My favorite part of the health counseling, my health counselor, you can't get any better than that. To have staff like that, it feels like they care. That is a real asset. If you're not healthy, you can't take care of your families. And if you're raising unhealthy children, what's our future going to be? I feel like that's something we have got to conquer. And we can do that. It's totally sustainable. That's life-changing. And if someone has diabetes, they can have hope.
People at work come up to me all the time and say, "Wow, Kevin, you look different." The question I get a lot, which I find very, very funny, is what are you taking? And I'm like, it's what I'm not taking. So I'm not taking my diabetes medicines anymore. I was diagnosed with type 2 diabetes a little over 6 years ago. It wasn't even a month later that we switched over to putting insulin into my regimen. Insulin, it was just such a scary word to me, even worse than diabetes. Before, it didn't seem like no one was real interested in reversing my diabetes. They were interested in treating my diabetes. At work, it was a struggle just to focus. When I first got started, you had to pick a goal that you felt would drive you through the hard times. And my goal was my family. I've been on it now for about 6 months, and it was 4 days after I started when I got off insulin. I feel the best I've felt in 15 years. I can't tell you how thankful I am. For us is a miracle, and it's given me back a quality of life that I never thought I would be able to enjoy again. The app is an incredibly helpful and useful tool in that I'm able to understand what's going on with my body. I'm able to communicate back all the things that are going on. It would be impossible for anybody to do this without assistance. My family is wonderful and they help me out with this, but it's my coaches making me feel that whatever this life brings you, we're all together in it to get through it.
I've been on insulin for at least 20 years. I knew I needed to make a lifestyle change. I always kind of joked sort of with my husband and said, you know, with all my health problems, you'll probably outlive me. And he would say, don't do that, don't say it. But it was the truth. And I got to a little over 190 pounds, and I said, whoa, something's got to happen. I want to get healthy, I want to live longer, and I want to get off of my insulin. They're not pushing medicines. They're trying to encourage you to be better at maintaining your own health. I dropped off of 100 units of insulin in the first 2 to 3 months. I'm not tied to eating unless I'm hungry. I'm not tied to my medicine, my shots. My legs are not tingly anymore. They don't feel like pins and needles. You know, I don't ache. I can walk. I'm in an exercise program. I have energy. I feel good from the moment I get up. I'm freer. The other day, I said, you know, I talked to you about that you'd probably outlive me, but I'm not too sure about that now. I said, I think I'm going to give you a run for your money. And he said, I think so too. When the doctor told me I looked 20 years younger, I think I feel 20 years younger too. I really do.
Manager at the Merck Durham site. I've been with the company for 17 years. All I can say to JLL is thank you. It's a life changer. Before I came to the conclusion, like, Guy, you're always going to be a diabetic. I thought there's no way that you can reverse diabetes. Every night, I hated to inject 35 units of insulin into me. When I started on the treatment, within the first month, the doctor had reduced it down to 20. Then he says, Guy, don't take any more insulin. And that was the proudest day in my life. And honestly, if I can do it, anybody can do it. The greatest thing with the treatment is you have a team of professionals that are working with you, supporting you. All you do is ask. And it's easy to follow too. They provide all the tools that you need to be successful. It's been the easiest treatment I've ever been on.
The last few minutes that you just watched are a typical results that we get for our clients consistently when we work together to master their type 2 diabetes without the pain of using uncomfortable medicines and insulin. What you are going to learn from this web seminar: why keto or low carb high fat is not an ideal meal for type 2 diabetics. Instead, what to eat at breakfast, lunch, dinner and snacks to master type 2 diabetes without medicines and insulin. Why and how type 2 diabetes is entirely reversible based on science. What are those 4 new 2018 American College of Physicians type 2 diabetes guidelines that the most type 2 diabetes individuals are still not aware of it? Why did the top American diabetes doctors like Dr. Sarah Holberg urge us to abandon the traditional outdated guidelines for the greater good for type 2 diabetics? Why did the Canadian doctor Jason Fung says that type 2 diabetes is a food-related issue and you only need the right foods to address it, not medicines and insulin? What are those 4 mistakes that the most type 2 diabetes individuals make every day and how you can avoid them? What are those commonly held misbeliefs that hold the most type 2 diabetes individuals from recovery? What is type 3 diabetes and how type 2 diabetes and type 3 diabetes are interconnected and how you can avoid type 3 diabetes too? And much more. Let me introduce myself. Hello there, Assalamu alaikum wa rahmatullah. My name is Mohammed Khan from Toronto, Canada. I am a man of 1 wife and father of 3 daughters. I am a certified professional nutritionist, member of Canadian Society of Nutrition Management and Indo-Vietnam Medical Board. Author of 3 best-selling books: Mastering Type 2 Diabetes Blueprint Without Medicines and Insulin, 90-Day Meal Plan to Master Type 2 Diabetes Naturally, and High Cholesterol, a double dealing of medical culture. And most importantly, I am a type 2 diabetes conqueror, which helped me immensely to become a certified type 2 diabetes educator over time. I help type 2 diabetes individuals to master and restore type 2 diabetes without medicines and insulin, as we already helped thousands of type 2 diabetes individuals till to date. So without further ado, let's get started. Mastering Type 2 Diabetes Blueprint. Discover the 4-step blueprint that naturally restores normal blood sugar in a week, even everything else you have tried has failed. If you want to get lower blood glucose naturally, avoid increased thirstiness, prevent excessive hungriness, if you want to stop frequent urination, be more energetic, stop feeling tingling, numbness or pain in the hand or leg, if you want to get healed your cuts and wounds faster, stop cravings to eat throughout the day, stay away from diabetes depression, then this is for you. Here is what you are going to learn. I will share with you the 4 discoveries and the 4-step blueprint or process that naturally restores normal blood sugar in a week so that you can reduce insulin resistance, thus recover from type 2 diabetes in the process. The real benefit of that, you will know what is the actual problem of type 2 diabetes, where from that problem come, why is that problem persists, and how to recover from type 2 diabetes naturally. Stick with me right until the end because you don't want to miss a thing, and whatever you are going to learn, you will be able to implement them right from today to lower your blood glucose naturally in just 1 week. And you might be one of the lucky person among 70% type 2 diabetes people. You might convert into non-diabetes according to the 4 new SCP peer-reviewed evidence-based guidance statements, which I am going to explain and will show you how to implement them shortly. And at last, I have a gift for you. Do you suffer with an imbalance in blood glucose levels, increased thirst, excessive hunger even if you are eating? Do you suffer with a frequent urination, fatigue, cravings to eat throughout the day? Do you suffer from slow healing of cuts and wounds, tingling, numbness or pain in the hands or feet? Do you suffer from blurry vision, patches of dark skin or itching and yeast infections? Do you also suffer from compromised erectile function or lack of it? Are you tired of using multiple medications and or insulin to lower blood glucose levels and is still not in control? It's not your fault. The real problem is that the management of blood glucose levels by medicine and or insulin is not a permanent solution. Here is why I say that according to the new SCP peer-reviewed evidence-based guidance statements 1, 2, 3 and 4 published in the Annals of Internal Medicine on March 6, 2018 to improve the quality of life of type 2 diabetes people. I know it looks overwhelming. If you visit the website, it seems even more daunting to understand. Just bear with me. In this presentation, I will simplify it from statements to interpret and how to implement in everyday life to get the most out of it. ACP stands for American College of Physicians, which is a national organization of internists who is specialized in the diagnosis, treatment, and care of adults. They never receive any funds from any drug or food companies in any shape or form, which makes them the highest credible organization on diabetes research of all time over others. But before I explain the 4 new SCP peer-reviewed evidence-based guidance statements, I would like to briefly explain the following 6 things which are widely used by the American College of Physicians researchers and which will be very helpful to understand these 4 new SCP guidance statements. There were many trials had been conducted about type 2 diabetes. For example, ACCORD trial, ADVANCE trial, UKPDS trial, VADT trial, DCCT trial, DPP trial, TICO trial, Elixir trial, Prospect trial, Consensus trial, etc. Among all of the above, the first 4 trials are widely accepted and used by the American College of Physicians researchers, and the ACCORD trial is the most famous of all. Cell. Many living organisms are so simple that they consist of just one cell, like bacteria, protozoa, unicellular algae, or fungi. The human body, however, is so complex that it consists of many trillions of them. Human cells differ even more notably in shape than in size. Some are flat, some are brick-shaped, some are thread-like, some are squamous, cuboidal, or column-shaped, as you can see in this figure. Apart from the size and shape here, the mitochondria and the cell membrane are to remember to understand type 2 diabetes easily, as indicated by 2 red arrows on the left. Human body tissue is another way of describing how our cells, grouped in a highly organized manner according to a specific structure and function. These groupings of cells form tissues. There are 4 types of tissues: connective tissue, epithelial tissue, muscle tissue, and nervous tissue. An organ is a structure made up of 2 or more kinds of tissue and organized to perform a more complex function than just one type of tissue. The major organs of the endocrine system are the pituitary gland, pineal gland, hypothalamus, thyroid gland, adrenal gland, pancreatic islets where alpha cell produces glucagon and beta cells produces insulin, which we will focus. A system is a group of organs that together perform a more complex function than does one organ. All the systems together made up a complete human body. There are 3 types of vessels in the blood circulating system: arteries, veins, and capillaries. Arteries carry oxygenated blood away from the heart to the cells of the body. Veins carry out deoxygenated blood from the cells of the body to the lungs and heart through capillaries. Capillaries are the exchange point of arteries and veins. All the cells of the body exchange nutrients, vitamins, minerals, oxygen, carbon dioxide, hydrogen ions, waste, and many other things through capillaries. And that's why the capillary blood factor is so essential to consider. In SCP peer-reviewed evidence-based guidance statements and all other trials, they used blood samples from veins, which is right or left arm or back of the palm. All clinics and hospitals also collect blood samples from veins, not from fingertips. But whenever you test at home, you take blood samples from the fingertip without considering the capillary blood factor. which I will explain shortly so that you can understand these 4 SCP guidance statements easily and you can apply this at home too. The sugar we know is called table sugar or regular sugar, mainly made from either beet sugar or cane sugar. As you can see, the 3 monosaccharides are glucose, galactose, fructose, and 3 disaccharides are maltose, lactose, sucrose. This sugar is a disaccharide, means 2 monosaccharides bonded together and become sucrose. In this case, 1 glucose monosaccharide and 1 fructose monosaccharide made up the disaccharide or sucrose or table sugar or regular sugar, which is 50% glucose and 50% fructose. The glucose digests in the stomach and go to the bloodstream faster than fructose and galactose, where fructose and galactose have to be converted into glucose in the liver before they go to the bloodstream. To understand the hemoglobin A1C or HbA1c test, we need to know what blood is. Blood consists of 4 main components: plasma, white blood cells, platelets, and red blood cells. Plasma, the blood that runs through the veins, capillaries, and arteries, is known as a whole blood, a mixture of about 55% plasma and 45% of blood cells. The primary purpose of plasma is to transport water, ions, proteins, nutrients, vitamins, minerals, wastes, hormones, and gases to the parts of the body that need it. White blood cells are the cells of lymphatic system or immune system, as you already know, that are involved in protecting the body against infectious disease and foreign invaders. Platelets are the tiny blood cells that help our body to form clots to stop bleeding. And red blood cells. This is the most vital part of understanding the HbA1c test or results, which is widely used by the new SCP guidance statements and all other trials, because this part of the blood carries the glucose, not sugar, because the sugar is a fructose and glucose. So this part of the blood is actually carrying the glucose only, as you can see in the picture. This red blood cell consists of mainly hemoglobin protein, and its life cycle is 120 days. The primary function of red blood cells or hemoglobin is to carry oxygen from the lung to the cells of the body and carbon dioxide and hydrogen ions away from the cells of the body back to the lungs. After 100 to 120 days, red blood cells or hemoglobin proteins are removed from the blood circulating system due to losing its functionality through a process called erythrocyte apoptosis or red blood cells program death, which is a natural process that occurs in injured red blood cells or hemoglobin proteins due to various wear and tear factors. When blood glucose levels are high due to wrong diet, glucose molecules attach to the hemoglobin protein of the red blood cell. The longer the glucose molecules stay in the blood, the more glucose molecules bind to the hemoglobin protein. After a chemical reaction, this hemoglobin protein becomes glycolylated, and this glycolylated hemoglobin protein remains that way till its life cycle, which is 120 days. And A1C is the name of a test that reflects your average blood glucose level over the past 90 days, which is just before the red blood cells program death. Here I just show you a generally simple to understand the conversion of HbA1c test results percentage to millimole per liter. Right or left arm vein or back of the palm blood sample used, not from the fingertip or capillary. This insulin resistance is the real problem of all type 2 diabetes, which is taken into account by the American College of Physicians and their researchers to educate type 2 diabetes people to improve their quality of life. So what is insulin? Our pancreas is called the insulin factory, which is part of the endocrine system, as you already know from the beginning of this presentation. The alpha cell of the pancreas produces the hormone glucagon and the beta cell produces the hormone insulin. Insulin is considered being the primary anabolic hormone of the body. It works like a key in the cell's door. When insulin present, the glucose can get into the cell for producing energy, as you can see by the 2 red arrows in this picture. For any reason, if the cell resistant to the insulin or if insulin can't function properly, which is happening with type 2 diabetes, the glucose can't go inside the cell and the cell can't function properly due to lack of fuel, which is glucose. So the person feels a lack of energy or fatigue. On the other hand, the glucagon hormone stimulates the liver to convert glycogen into glucose, which can be released into the bloodstream when the blood glucose level is too low. Insulin functions in three ways. It helps your body to use the glucose from the food that you eat for energy, as per your body's requirement, which is determined by your gender, height, weight, activity level, weather condition, fever, infection, or any other physiological or psychological stress. Secondly, if there is more glucose than is required, then the insulin will store that extra glucose in the liver as glycogen. And thirdly, there is a limit to store glucose as glycogen in the liver. So when it reaches the threshold, the excess glucose produces fat in the liver and is stored in adipose tissue or muscle cells by the help of the insulin. When there is no food or when someone fasting, means the body does not have food, so that there is no glucose. At that time, the amount of insulin decreases. Then the body first go to the glycogen, which is stored in the liver, to get the glucose by the help of glucagon hormone, which is produced in the pancreas alpha cell. It stimulates the liver to release the required glucose in the bloodstream. When the glycogen used up, then the body goes to the fat storage in the adipose tissue or muscle cells to get the required glucose by burning the fat. The pancreas is an organ located in the abdomen. It plays an essential role in converting the food we eat into fuel for the cells of the body. It has two main functions. It helps in digestion and regulates blood glucose. In the top picture, as you can see, the pancreas beta cells produce insulin, and that insulin is accepted by the cells of the body and allow the insulin to work as a key so the glucose can get into the cell as a fuel for the energy, and the cycle keeps going on. In the middle picture, which is type 1 diabetes, the pancreas beta cell is unable to produce insulin. The cells of the body is waiting for the insulin as a key of the cell's door to open for the glucose to get in. Even the cells are ready to accept the insulin, but there is no insulin available from the pancreas beta cell. That's why type 1 diabetes people takes insulin from an external source to get the glucose into the cell for energy. But in the bottom picture, which is type 2 diabetes, the pancreas can produce insulin, but due to many wrong food choices or lifestyle, the cell resistant to the insulin or the insulin can't function properly. That's why the insulin can't work as a key to help the glucose to get into the cell for energy. That's why type 2 diabetes people feel a lack of energy or tiredness. There are many reasons for cells resistant to insulin, but here are some common ones: abdominal fat and obesity, lack of quality sleep or skimping on sleep, excess carb consumption, chronic illness and inflammation, polycystic ovary syndrome, overweight, too much belly fat, lack of exercise, smoking, overstress, etc. So now you are covered with some basics. Without further ado, let's get started. The new SAP peer-reviewed evidence-based guidance statements. Number 1. Clinicians should personalize goals for glycemic control or typical levels of blood glucose in patients with type 2 diabetes based on a discussion of benefits and harms of pharmacotherapy or treatment using drugs, patients' preferences, patients' general health and life expectancy, treatment burden, and cost of care. Interpretation of guidance statement 1 based on the famous ECHO trial, where it is seen that trying to control high blood glucose with medicine or insulin may result in lowering of blood glucose level and achieving a target of HbA1c below 6%, but at the cost of 22% more death, 36% more cardiovascular related death, means heart attack, stroke, increased weight by 10 kg and increased fluid retention. So the new SAP guidance statement discourages clinicians or medical practitioners from using medicine or insulin to control high blood glucose. High blood glucose greater than 220 mg or 12.7 millimole or HbA1c higher than 8% is substandard, but trying to lower it with medicine or insulin is worse, as you can see in the left column in this slide. The asterisk marks imply 10% value added for easy understanding in your end, considering blood samples taken from the capillary blood or fingertip at home settings. I will provide you the SAP HbA1c conversion formula on how they calculate it in the next slide. The new SAP peer-reviewed evidence-based guidance statement number 2 is: clinicians should aim to achieve an HbA1c level between 7 to 8% in most patients with type 2 diabetes. Interpretation of guidance statement number 2 based on the results of UKPDS and VADD trials shown where maintaining the HbA1c near 8% and 8.4% is more beneficial for the patients in comparison who is trying to achieve a goal of HbA1c less than 6% or lower. Here I provide you the ACP HbA1c calculation formula in both formats, milligram per deciliter or millimole per liter, which has been used widely by the ACP researchers in all trials, and you can use it too. As well as I also showed here the actual calculation of HbA1c 6% and 8% using the ACP formula for your convenience. If you want to calculate in milligrams per deciliter, the ACP formula is multiply your HbA1c test results by 35.6, then deduct 77.3, which will give you milligrams per deciliter. Or if you want to calculate in millimoles per liter, the ACP formula is to multiply your HbA1c test results by 1.98, then deduct 4.29, which will give you millimole per liter. This calculation means every day on average, if you can maintain a blood glucose level 228 mg or 12.7 millimole, then it translates to HbA1c equal to 8%. So maintaining the HbA1c under 6% or lower with medicine or insulin will not reduce death or microvascular diseases such as eye disease, kidney disease, nerve damage, and macrovascular complications such as heart attack or stroke as per this guidance statement. Again, the asterisk marks imply 10% value added for easy understanding in your end, considering blood sample taken from the capillary blood or fingertip at home settings according to the ACP formula. The new ACP peer-reviewed evidence-based guidance statement number 3 is, clinicians should consider de-intensifying pharmacologic therapy in patients with type 2 diabetes who achieve HbA1c levels less than 6.5%. Interpretation of guidance statement 3 based on the results of UKPDS and VADT trial using the above formula, HbA1c of 6.5% translate to 170 mg per deciliter or 9.4 millimole per liter. Means while on diabetes medication or insulin, if your blood glucose drops below 170 mg or 9.4 millimole, then you need to taper down or discontinue the drug or medicine or insulin. The new ACP peer-reviewed evidence-based guidance statement 4 is, clinicians should treat patients with type 2 diabetes to minimize symptoms related to hyperglycemia and avoid targeting an HbA1c level in patients with a life expectancy less than 10 years due to advanced age, 80 years or older, residents in a nursing home, or chronic conditions such as dementia, cancer, end-stage kidney disease, or severe chronic obstructive pulmonary disease, or congestive heart failure, because the harms outweigh the benefits in this population. Interpretation of guidance statement number 4 based on VADT trial. In VADT trial, it was seen that trying to control the high blood glucose levels with medicine and or insulin among the patients older than 80 years, and especially with chronic conditions like heart disease, chronic obstructive pulmonary disease, cancer, dementia, led to increased risk of death and other adverse effects like more hypoglycemia. Hypoglycemia is a fall in blood glucose to levels below normal. This may result in a variety of symptoms including clumsiness, trouble talking, confusion, loss of consciousness, seizures, or death, which is more dangerous than hyperglycemia or high blood glucose. 3 times higher impaired consciousness, more breathing problems. The good news is that I have figured out a more straightforward way to solve this problem, and I will walk with you through it in this webinar. The key to reverse type 2 diabetes naturally is reducing insulin resistance by the correct diet. With this, you will wake up each morning feeling full of energy with an expected blood glucose level. You won't need to prick your fingertips with a lancet every day right in the morning. With this, you will wake up each morning feeling you have a normal blood pressure, healthy cholesterol. As a result, your erectile function will become healthy again. You will be able to eat even more without depriving yourself, counting calories and thinking of glucose level rise. With this, you will be able to reduce or stop dependency on medications and or insulin. You will feel that you can live a healthy life just like any other rational human being. The best part is, even if you heard or told that type 2 diabetes is a chronic, progressive and irreversible, today in this video I am going to debunk one of the biggest misbeliefs that type 2 diabetes is chronic, progressive and irreversible, which is absolutely not true. Without further ado, let's go to my computer to better understanding through illustration. It is because of type 2 diabetes people treated under the wrong treatment paradigm. They focus only on lowering high blood glucose from the blood instead of concentrating on reducing insulin resistance, which is the real big problem of all type 2 diabetes. The current treatment system is thinking that type 2 diabetes people do not produce insulin, so they need to inject insulin externally, which is utterly wrong. Because type 2 diabetes people do produce insulin, but due to some wrong food choice and lifestyle, that insulin cannot work properly or are not allowed to work by the cell. Where type 1 diabetes people do not produce insulin at all, and that's why they need to inject insulin externally. A fundamentally wrong approach to treat type 2 diabetes people, and that's why with the current type 2 diabetes treatment paradigm, people are getting more and more sicker than to recover. According to the New American College of Physicians Guidance Statement number 1 and the famous ECHO trial. Now, if type 2 diabetes is a chronic, progressive and irreversible, then how come people who undergo bariatric or gastric banding surgery and reduce insulin resistance in 12 weeks and recover from type 2 diabetes? Let's see how. Bariatric surgery helps reduce insulin resistance in 12 weeks and recover from type 2 diabetes. Bariatric surgery work by changing the anatomy of your stomach and the digestive system, as you can see in the picture by the red and black arrow, to help you lose weight, improve your energy balance and fat metabolism. But due to progressive abdominal pain within the first few weeks after the surgery could be caused by a slow leak or perforation. This type of leaks require emergency admission to the hospital. In some cases, urgent surgery is needed. Therefore, people do not like it. Another surgery called gastric banding also helps reduce insulin resistance in 12 weeks duration. Hence, recover from type 2 diabetes. This surgery involves placing an adjustable silicone gastric band around the upper part of the stomach, as you can see in the picture indicating by the long red arrow, to decrease stomach size and reduce food intake to improve energy balance and fat metabolism. The band creates a small stomach pouch above it with the rest of the stomach below. The procedure constricts the stomach so the person feels full after eating less food than usual. But due to a maladaptive eating behavior is a common cause of abdominal pain in the early post-operative period, gastric bypass alters satiety and the patient may not perceive fullness until pouch distension to the point of pain. Therefore, people do not like it too. Now, instead of surgery, some people choose to use drugs to achieve the same results. And with the side effects of these drugs, people still reduce insulin resistance in 12 weeks and recover from type 2 diabetes. Let's see how it works. Drug acarbose helps reduce insulin resistance in 12 weeks of using it. And in the process, people recover from type 2 diabetes if someone continues utilizing this drug. This drug works by slowing the action of certain chemicals that breaks down food to release glucose into your blood, as you can see on the right side of the picture. Where metformin works by releasing the amount of glucose your liver releases into your blood to prevent the rise of the glucose level in the blood, which is the left side of this picture. But there are many side effects of this drug, which are allergic reaction, severe itching, severe stomach pain, severe constipation, watery or bloody diarrhea, etc. That's why people do not like this drug. Another drug called SGLT2 protein inhibitor also reduces insulin resistance using 12 weeks period. SGLT means sodium glucose co-transporter protein. There are two proteins, sodium glucose co-transporter number 1 protein and sodium glucose co-transporter number 2 protein. We will learn about SGLT2 protein here. So the function of the SGLT2 protein is to reabsorb the glucose from the kidney and back into the bloodstream. This SGLT2 protein inhibitor works by preventing the protein from reabsorbing the glucose from the kidney. It blocks those proteins, as you can see the red upward arrows in the picture, which means less glucose gets reabsorbed back into the blood and more gets passed out of the body via the urine. Thus, by reducing the glucose from the blood helps to reduce insulin resistance in 12 weeks period of using these drugs. Hence, people recover from type 2 diabetes. But there are many side effects of this drug, which are genital yeast infection in men and women, urinary tract infection, increased urination, kidney problems, constipation, etc. That's why people do not like this drug either. Fasting protocol, which is the natural alternative of surgeries and drugs mentioned above, also promote blood glucose control by reducing insulin resistance in less than 12 weeks without significant side effects. Hence, people recover from type 2 diabetes faster than above 4 methods. if they continue with the right diet and the right amount. Because if the person fasting for certain hours, but when they break the fast with the wrong types of food, then the whole purpose of fasting is ruined. Now, if bariatric surgery, gastric banding, drug acarbose, drug SGLT2 protein inhibitor, and fasting protocol can reduce insulin resistance in 12 weeks period and recover from type 2 diabetes, then where did the idea come from that type 2 diabetes is a chronic, progressive, and irreversible? It is because the current protocol focuses only on lowering high blood glucose from the blood using medicine or insulin. Instead, focus on reducing insulin resistance, which is the real big problem of all type 2 diabetes and often overlooked. Now, if you have a fever due to virus or bacterial infection, and instead of treating the infection with an antibody, if you take a Tylenol or Advil just to treat the fever, your fever may become lower in terms of temperature and you may feel better for a short term, but your infection is becoming worse as time goes by. The same things happening with type 2 diabetes. Our current protocol is only targeting to lower the high blood glucose by medicine or insulin. For the time being, maybe the glucose level from the blood gets lower, but the real problem is insulin resistance becoming worse as time goes by. Then more and more insulin needed to lower the same glucose level, and the patient's condition and the insulin resistance become even worse, according to the new American College of Physicians guidance statement number 1 and famous ACCORD trial. The last thing you will do to give more alcohol to an alcoholic or to give more drugs to a drug abuser, if you do care for that person or if you are a real well-wisher. Due to this fundamental shift in the treatment of type 2 diabetes, people are not getting well, even after 10, 20 or 30 years of taking medicine or insulin. Imagine your body as a big sugar container. At birth, the container is empty. Over 3 to 4 decades, you eat sugar and refined carbohydrates, and the container gradually fills up. When you eat next, sugar comes in and it spills over the sides of the container because the container is already full. The same situation exists in your body. When you eat sugar and or high carbohydrate diet, your body releases the hormone insulin to help move the sugar into your cells where it used for energy. If you don't burn off that sugar sufficiently, then over 3 to 4 decades, your cells become completely filled and cannot handle anymore. The next time when you eat sugar and or high carbohydrate diet, insulin cannot force it anymore of it into your overflowing cells. So it spills out into the blood. Sugar travels in your blood in a form called glucose, and having too much of it, known as high blood glucose, is a primary symptom of type 2 diabetes. When there is too much glucose in the blood, insulin does not appear to be doing its usual job of moving the sugar into the cells. Then we say that the body has become insulin resistant, but it's not truly insulin's fault. The primary problem is that the cells are overflowing with glucose. The high blood glucose is only part of the issue. Not only there is too much glucose in the blood, but also there is too much glucose in all the cells of the body. Type 2 diabetes is simply an overflow situation that occurs when there is too much glucose in the whole body. In response to excess glucose in the blood, the body releases even more insulin to overcome this resistance. This forces more glucose into the overflowing cells to keep the blood levels normal. This works, but the effect is only temporary because it has not addressed the problem of excess sugar. It has only moved the excess sugar from the blood to the cells, making insulin resistance even worse. At some point, even with more insulin, the body cannot force any more glucose into the cells. Think about packing a piece of luggage. At first, the clothes go into the empty luggage without any trouble. Once the luggage is full, however, it becomes difficult to jam in those last 2 t-shirts. You reach to a point where you can't close the luggage. You could say the luggage appears to be resisting the clothes. This is similar to the overflow situation we see in our cells. Once that luggage is full, you might simply use more force to shove those last t-shirts. This strategy will work temporarily because you have not addressed the underlying problem of the overfilled luggage. As you force more t-shirts into the luggage, the problem only becomes worse. The better solution is to remove some of the clothes from the luggage. What happens in the body if you do not remove the excess glucose? First, the body keeps increasing the amount of insulin it produces to try to force more glucose into the cells, but this only creates more insulin resistance, then becomes a vicious cycle. When the insulin levels can no longer keep pace with the rising resistance, blood glucose spikes. That's when your doctor is likely to diagnose type 2 diabetes.
Your doctor may prescribe a medication such as insulin injections or perhaps a drug called metformin to lower blood glucose. But these drugs do not get rid of the body of excess glucose. Instead, they continue to take the glucose out of the blood and cramps it back into the body. Then it shipped out to other organs such as the kidneys, the nerves, the eyes, and the heart, where it can eventually create additional problems. The underlying problem is still unchanged. Remember the container that was overflowing with sugar? It is still overflowing. Insulin has moved the glucose from the blood where you can see into the body where you cannot see. So the very next time you eat, sugar spills out into the blood again, and you inject insulin to cram it into your body. Whether you think it as like a piece of overstuffed luggage or an overflowing container, it is the same situation all over again. The more glucose you force your body to accept, the more insulin your body needs to overcome the resistance to it. But this insulin only creates more resistance as the cells become more and more expanded. Once you have exceeded what your body can produce naturally, medications can take over. At first, you need only a single medication, but eventually it becomes 2 and then 3, and the doses become larger. And here is the thing, if you are taking more and more medications to keep your blood glucose at the same level, your diabetes is getting worse. The blood glucose got better with insulin, but the diabetes got worse. The medications only hit the blood glucose by cramming it into the cells, which is already bloated. The diabetes looks better in terms of blood glucose level in the glucometer, but actually it is worse in the whole body. Doctors may congratulate themselves on the illusion of a job well done. Even the patients get sicker. No amount of medication prevents the heart attacks, congestive heart failure, strokes, kidney failure, amputations, and blindness that result when diabetes is getting worse. Then they say, oh, it's a chronic and progressive disease. But it was not. Here is an example. Consider that hiding garbage under your bed instead of throwing it out allows you to pretend that your kitchen is clean. When there is no more room under the bed, you can throw the garbage under the rug, then in the basement, in the closet, even in the bathroom. But if you keep hiding your garbage, eventually it is going to smell bad because it's starting to rot. Instead of hiding it, you need to throw it out. If the solution to your overflowing luggage and your overflowing house seems obvious, the resolution of too much glucose, which leads to too much insulin, should also be similar. Get rid out of it. But the standard treatment for type 2 diabetes follows the same wrong logic of hiding the glucose instead of getting rid out of it. If you understand that too much glucose in the blood is toxic, too much glucose in the body is also toxic. What happens when excessive glucose piles up in the body over 10, 20 or 30 years? Every cell in the body starts to rot, which is precisely why type 2 diabetes affects every single organ of the body. Your eyes rot and you go blind. Your kidneys rot and you need dialysis. Your heart rots and you get heart attack and heart failure. Your brain rots and you get Alzheimer's disease. Your liver rots and you get fatty liver and liver cirrhosis. Your legs rot and you get diabetes foot ulcer and eventually amputation. Your nerves rot and you get diabetic neuropathy. No part of your body is free from being rot. That's why the scientific community named type 2 diabetes is the mother of all diseases. Standard medications do not prevent the progression of organ failure because they do not help eliminate the toxic sugar load from the body. More than 7 multinational, multi-center, randomized, and placebo-controlled trials have proved that standard medications that lower blood glucose does not reduce heart diseases, the major killer of type 2 diabetes patients. According to a famous Canadian nephrologist, Dr. Jason Fang, you have pretended that those glucose-lowering medications make you healthier, but it's been a lie. You have overlooked a singular truth that you can't use drugs to cure a dietary issue. As well as once Dr. Werner Wheelock said, if I had a flood in my house, I would not spend day after day, week after week or year after year to buying buckets, mops and towels. I would not be inventing different types of buckets and more expensive mops or drainage systems to ensure the water drained away quickly. Instead, I would find the source of the water and turn it off.
Moreover, I would like to conclude this by Dr. Sarah Hallberg's eye-opening presentation in 2015 at a TEDx event at Purdue University, Indiana, United States, which accounted for over 5 million views on YouTube and is still growing, where she said reversing type 2 diabetes starts with ignoring the guidelines. There you know now that type 2 diabetes is entirely reversible, not progressive and not chronic, and this education is being hidden from people with type 2 diabetes for some obvious reason. The longer you hold this misbelief, the longer you will be sick. The longer you keep type 2 diabetes under maintenance, the more maintenance cost will be as time goes by, and your health deteriorates substantially, and you possibly could lose your vital organs like eyes, kidneys, or even health over time. The best part is, even if you think that type 2 diabetes is a medical disease, not a food and lifestyle related issue. First of all, type 2 diabetes is not a disease. You heard that it is a disease. Your surroundings made you believe that over time. Type 2 diabetes is not a medically recognized disease until microvascular tissue damaged in organs like eyes, kidneys, brain, heart, etc. due to the long period of high blood glucose circulating in the blood circulating system. If high blood glucose circulating for a long time, this will damage excessively the blood arteries, capillaries and veins, which are the carrier of necessary oxygen, nutrients, vitamins, minerals, waste and carbon dioxide for all the cells and organs of the body. Blood arteries, veins and capillaries can stretch to a specific limit for a particular time to accommodate this overflow of glucose. If the glucose is overflowing continually, the blood circulating system as a whole lost its functionality. As an example, if an army war tank runs on our road just for 5 years, what will happen to those roads? Can you please imagine just for 1 second? After 5 years, those roads won't be useful for regular use and will be required resurfacing. This monosaccharide glucose causes the excessive wear and tear when overflowing to the blood arteries, veins and capillaries. Then the blood cannot reach to those organs through the capillary blood vessels. Now those organs start lacking of nutrients, vitamins, minerals and getting filled by waste and lack of proper exchange of oxygen and carbon dioxide. Then those organs began to lose their functionality. If this happened continually, then those organs started to fail to work after a while. Then they turned to a medically recognized disease, which was not initially. These capillary blood vessels are very tiny and have minimal ability to stretch for a very limited time than arteries. Now, when these capillary blood vessels experience overflow of glucose for a long time, it tears apart the capillary walls after a while, faster than arteries because the artery size is more prominent in diameter. As an example, if high blood glucose flows continually after a particular time, this glucose tears apart the light-sensitive tissues in the back of the eyes, which is called the retina. Initially, the person will experience blurry vision. If this continues, these light-sensitive tissues will not be able to function. The person lost the eyesight, then the person becomes blind, which is now a medically recognized disease and called diabetic retinopathy. Initially, it wasn't. The same goes for the kidney. When this high glucose flows for a long time, it tears apart the glomerulus in the nephron of the kidney. Its primary function reabsorbed the glucose from the waste and put back into the bloodstream. Then the filtration compromised. If this continues, the glomerulus cannot filter anymore. Then the person experiences kidney pain and kidney disease and eventually kidney dialysis, which is called diabetic nephropathy, which is now medically recognized disease. Initially, it wasn't. The best part is, even if you think or told that type 2 diabetes is genetic, type 2 diabetes is not genetic at all, like type 1 diabetes, where type 1 diabetes people pancreas beta cells cannot produce insulin, as you have seen already, and that's why they need insulin externally. On the other hand, type 2 diabetes people pancreas beta cells produce insulin. Still, the body cells cannot use that insulin or not allowing the insulin to work properly for various food and lifestyle related reasons. In general, type 2 diabetes appeared at the age of 25, 30 and onwards. If it is genetic, it should be appeared in childhood like type 1 diabetes. The best part is, even if you think that you are visiting the right professional healthcare provider for the last 5, 10, 20 years with loyalty. With due respect, I am not judging here anyone in any way. It's not about how many years you are visiting or wherever you are going. It's all about to whom you are visiting. What I want to say is that if you are going to learn how to play soccer,
You obviously will not hire a soccer coach who had never played soccer but have the highest educational degree in soccer. Or if your car has a problem in the electrical system, but you took your car to body repair shop to fix your car electrical system, the car body shop will refer you or should refer to a car electrical mechanic. Otherwise, due to a faulty electrical repair, the car could be in a fire down the road. The vehicle has many different systems that needs to function seamlessly, as like the human body has 11 different systems, as you know from the beginning of this presentation. Even though they both are car mechanic, but they both have entirely different skills. Or if you ask for help from someone who has type 2 diabetes, they even don't know what exactly the problem is. Yet many cases they are very highly educated, but they still don't know what to do precisely in terms of reducing insulin resistance. They can't help themselves. Even if they advise you to do something, that will not make any significant difference. You will be circling in the same circle over and over, and your insulin resistance will become worse over time. The best part is, even if you think that you are doing just fine with the medicine and or insulin with your type 2 diabetes, in the new ACP or American College of Physicians peer-reviewed evidence-based guidance statement number 1 and the famous ACCORD trial mentioned that trying to control high blood glucose with the medicine or insulin may result in lowering of blood glucose and HbA1c below 6%, however at the cost of 22% more death, 36% more cardiovascular related death means heart attack, stroke, coronary artery disease, increased weight by 10 kg, increased fluid retention in the body. So this new diabetes guidance statement discourages using the medicine or insulin to control high blood glucose levels. The best part is, even if you think that you can continue to take the medicine or insulin and solve the type 2 diabetes symptoms or complications for faster. As we all know, if you take a food as medicine, then you won't need medicine as food. Also, once Hippocrates told in 400 BC, let thy food be thy medicine, not the other way around. In any food-related health issue, there is no shortcut to getting well by addressing the issue by medicine. Using medicine to address food-related health issue not only destroy or reduce body's powerful internal healing mechanism, but also could reach to a point of no return. Would cost more than a fortune to return from that point. Where in early stage to address the food-related issue, using food would be way faster, more comfortable and cost-effective than any medicine or anyone ever could imagine. In reality, according to research, someone from non-type 2 diabetes to full-blown type 2 diabetes takes more or less 12 to 13 years. Even though the liver gives a signal as a high blood cholesterol deposits in the blood, it is known as a pre-diabetes. But many people do not know how to interpret the message of the liver and start taking cholesterol lowering drugs. This signal from the liver says to watch out the diet, not to start cholesterol lowering drugs. Otherwise, soon the pancreas or insulin factory will shut down, or the insulin will not be welcomed by the cells anymore, which is called full-blown type 2 diabetes. On top of the situation, external medicine or insulin will cause more imbalance in the internal homeostasis. Type 2 diabetes is 100% food and lifestyle related issue, and using diet to address it is the right approach, which is faster and more natural with a fraction of cost, time and efforts instead spent on medicine or insulin and ultimately pay a fortune at the end. Because we care for our health more when it is about to lose, and that time we do everything to get it back instead of taking a small initiative on time would save health, life and bank. The best part is, even if you see people who were not able to reverse type 2 diabetes even using the right diet, the diet is a part of the whole effort. If you see the entire thing, you will know that it may have a lack of support and guidance. Possibly they did not get daily support and guidance or a sustainable diet plan or an expert coach. They did not get help whenever they fall off the track, or they did not get clear and defined goals. Maybe they did not get teaching in bite-sized chunk over time, not a fire hose of information on the first day or week. Perhaps they did not get to teach the right mindset along with the healthy habits and behavior necessary to reduce insulin resistance, thus recover from type 2 diabetes and keep it off. Maybe they did not receive constant support and accountability from a real human being every single day. Perhaps they did not get an expert who knows how to get you the results you want and understand how to get you through anything and everything that will get in the way. I can go on, but I think you get the point. Unless you are being held accountable, it's tough to stick with it alone. It's too easy to rationalize to ourselves. And that's why you see people around you were not able to recover from type 2 diabetes using the right diet. The best part is, even if you think that you tried many diets before and didn't work, it is because of a lack of proper accountability. It is hard to explain the power of it unless you have experienced it. Imagine it's your first day of school. The bell rings and your new physics professor walks in. He is carrying a giant physics textbook. He looks straight at the class and slams the book down on the table. He looks at the class and tells, "You have 6 months to study. At the end of the 6th month, you will have an exam. Good luck." He then walks out of the room. Now let me ask you, who do you think will pass a class like this? This physics professor has set the class up for failure. Instead, what if the same professor holds class every day, has an office hour to ask questions, lets you correct when you are wrong, supports you or guides you every step of the way? What do you think the success rate will be? Very high, obviously. You see, the big difference between everyone failing and everyone passing is the amount of support or guidance they got. Same with the diet. Traditionally, you are told, here is a diet to follow. Do it. Good luck. Assuming a lack of knowledge is a big issue, but the real problem is a lack of consistent action or compliance. Due to a lack of accountability, traditional program doesn't work. The best part is, even if you know or think that diet means boring and you must avoid or sacrifice party, occasions, ceremonies or anniversary, etc., it's because you may got some coaches who may know how to cook but lack of art, or who just didn't take enough time to do more about this part to make it irresistible and mouth-watering regardless breakfast, lunch, dinner, snacks, regardless of ethnicity, culture, health condition, teeth condition, male or female or any other thing. It is effortless and possible to turn any food ingredients into mouth-watering dishes if there is a passion. To be creative in cooking virtually limitless. With that said, you really do not have to miss or sacrifice any party, occasions, ceremonies or anniversary, etc. The best part is, even if you are too busy in your life to follow the diet, it is because you never came across a coach who knows how to consider factors like that and work around it to design out the right menu using the right type of food to reduce insulin resistance, thus achieve your goal, even if you are too busy in your life. The best part is, even if you know having some foods or drinks that help reverse type 2 diabetes means reduce insulin resistance. If you know that some foods aid in reverse type 2 diabetes, those foods are not a complete diet to provide a person's daily usual intakes of average 2000 calories with minerals, micro and macro vitamins. Example, people says bitter melon juice is good for type 2 diabetes. Yes, that is good. It has insulin properties. But 8 to 10 glasses of bitter melon juice will be needed to drink every day. Now imagine how many kilograms of bitter melon will be required to make 8 to 10 glasses of juice every day. Moreover, by drinking 8 to 10 glasses of bitter melon juice, anyone cannot get the required daily calories, minerals, vitamins. And if it is cooked or heated, the insulin properties will be ineffective. Plus, if the primary food intakes not composed with the right types of food and not in a correct amount, then 8 to 10 glasses of bitter melon juice will not work as effectively to reduce insulin resistance. That's why people can't stay on those foods and can't get out of type 2 diabetes, those who follow these types of food. Because the body does not get enough calories, and after a particular time the body creates cravings, and then the person drop them and go back to their original old habitual diet, and the vicious cycle keeps going on. More or less the same things happen with other similar types of food or drinks. The best part is, even if you tried many diets in the past and didn't work, It is because you attempted wrong types of food and in the incorrect amount, where many factors including gender, height, weight, activity level, physical condition or any other physiological or psychological stress not accounted for to design the diet with the right types of food to keep you full, make you satisfied, to stop cravings and lower blood glucose, thus reduce insulin resistance. That's why it didn't work. The best part is, even if you know that type 2 diabetes people need to eat every 2-3 hours, then how will I be fasting? The type of food you eat burns and passes through your stomach fast, then go to the bloodstream, and that is happening with you for many years. And over time, which altered your belief system too. All you need is to prepare your diet from the right types of food with the right amount according to your gender, height, weight, activity level, physical condition, which will keep you full, make you satisfied, and will not pass through your stomach that fast and go to the bloodstream. Therefore, you won't need to eat every 2-3 hours, so you can fast easily. And the only reason I can share this with you is because I have been through this, the good, the bad.
I was an insulin-dependent type 2 diabetes, trying to replace my foods with the right ones. I really wanted to regain my health. I wanted to live life without insulin needles, so I wouldn't have to feel horrible whenever I poke my body with insulin needles multiple times a day, years after years. I really wanted to live life without poking my body with insulin needles so that I could live life without insulin and their side effects. The thing is that I failed to figure out what are those right foods to eat. That meant I wasn't able to live life without poking my body with insulin needles, let alone live life without insulin and its side effects. To make things worse, I felt terrible with insulin needles and too tired to work. I felt even worse about the situation because my sugar levels and insulin use increased as time went by. Overall, I felt like jumping off a building. The problem was that I couldn't tolerate anymore poking my body with the insulin needles, which meant I had to stop insulin and listening to others while my sugar levels kept going higher despite higher insulin doses. Then by chance, something amazing happened. I found a way all about eating those right foods to control my sugar levels without insulin needles. It was now crystal clear to me how to eat right and get more energy all day long because I noticed that I can eat more without thinking of sugar levels and without insulin needles when I eat right. I also learned that there is no way back once you are on insulin, so I need to get started and build a momentum instead. As a result, I started to eat the right breakfast. After I did that, I started getting the energy I need and feeling more refreshed. I was noticing that my external insulin requirement was decreasing. So I had to gradually reduce insulin needles to prevent hypo, which is even worse than high blood sugar itself. After a few months of testing and tweaking my meal plan, I was able to stop taking insulin needles safely and successfully. That's when I realized that the secret of replacing my foods with the right ones taught me to control high blood sugar levels without insulin needles. I plan to start eating more of these right foods in lunch and dinner. I also started incorporating other foods in my snacks too. But we didn't stop there. Then we created and started selling meal plans to insulin-dependent type 2 diabetes people. And after that, we kept creating new meal plans and training to sell to our growing audience. But there was still a problem. As my business grew, I was struggling to keep up. I was a one-person show and was doing everything, including client service, marketing, content creation, billing, product creation, so and so. Basically, I got to the point where I had more money than time and I needed some help because I was spending a lot of time working than I was in my previous practice. Plus, I couldn't spend quality time with my family and kids, even though I was with them and I was not happy yet. We ended up getting so frustrated. Then we decided to create a set of proven meal plan templates that allowed insulin-dependent type 2 diabetes to control high sugar levels without insulin needles.
even though they are on external insulin dependent for many years. We choose to call it freedom from external insulin coaching, the complete coaching to be free from insulin dependency. We thought if we could create something that would help insulin-dependent type 2 diabetics quit insulin in a few months, we would be really happy. After many months of tweaking, we tested every aspect of what it takes to control high blood sugar without insulin needles. We created freedom from external insulin coaching. I can now control high blood sugar without insulin needles. Then we started to let other insulin-dependent type 2 diabetes individuals use freedom from external insulin coaching. As a result of all of this, we were able to achieve the followings. I was able to quit insulin after suffering for many years with type 2 diabetes. I helped my family members leave from external insulin use. I helped 953 insulin-dependent type 2 diabetes quits from insulin in less than 1 month last year alone. In fact, in 2019, we had 687 insulin-dependent type 2 diabetes who quit insulin in a week successfully, despite the misbeliefs that once they started insulin, there is no way back, even though many of them were external insulin dependent for more than 20 years. After creating freedom from external insulin coaching, I could not only live life without insulin needles, but also can eat more without spiking sugar levels. Because now we can control high blood sugar levels without insulin needles so quickly and safely. And in the end, all of this means I am now able to eat more confidently without thinking of sugar levels and insulin needles. Instead of dragging all day due to lack of energy, I am doing more of the things I really enjoy and are more meaningful in my life. Imagine what life looks like when you do not need to wake up with worry thinking of blood glucose level, when you don't have to visit the doctor's office multiple times in a week or month, when you don't have to take multiple medications every day or poking your body with insulin injections a few times a day, when you can eat even more without thinking of glucose level rise and feel energetic throughout the day, when you have a normal blood pressure, healthy cholesterol level, and therefore you got back to normal erectile function and you can enjoy life once again on its full, when you see that beautiful smile again to your spouse face, when you don't have to deal with any type 2 diabetes related health complications. Management of blood glucose levels by medicine and or insulin is not a permanent solution, and I have discovered the 4-step blueprint to lower blood glucose levels naturally in just 1 week. Discovery number 1. Using medicine and or insulin to lower blood glucose level and HbA1c is alright. Using medicine and or insulin to lower blood glucose level and HbA1c under 6% or lower is more harmful than it helps, because it causes 22% increased death, 36% more cardiovascular related death, means heart attack, stroke, increased weight gain by 10 kg, and increased fluid retention. Moreover, the side effects of these medicines caused high blood pressure, high cholesterol, and compromised erectile function, according to the new ACP or American College of Physicians guidance statement number 1 and the famous ECHO trial. Using medicine or insulin to lower blood glucose is an old way, which is not working, and more people are affected by its side effect every single day worldwide and experienced more death, heart attack, stroke, weight gain, and fatal fluid or water retention. And the new way is to lower blood glucose naturally by a correct diet, which is completely side effect free, and people are reduced insulin resistance, hence recover from type 2 diabetes faster and sustainably. Discovery number 2. Measuring fasting blood glucose as a base of glucose level reading. Measuring fasting blood glucose as a base is misleading and most unreliable, as it entirely depends on the person's eating habits, because everyone has different habits and everyone is built on a distinct set of practices. Therefore, their liver releases varying amounts of glucose early in the morning to do some tasks like waking up, washing, brushing, getting ready to prepare breakfast, and so on, which is called dawn phenomena. That's why fasting blood glucose measurement leads to the wrong reading, and incorrect blood glucose measurement leads to the wrong diagnosis, which leads to wrong doses of medicine or insulin. The dawn phenomena, also called the dawn effect, is the term used to describe an abnormal early morning release in the blood glucose, usually between 2 a.m. to 8 a.m. in people with type 2 diabetes. Some researchers believe the natural overnight release of the so-called counter-regulatory hormones, including growth hormone, cortisol, glucagon, and epinephrine, increases insulin resistance, causing blood glucose to rise. Because dawn phenomena leads to unreliable blood glucose reading, which leads to wrong diagnosis and wrong doses of medications or insulin, which is ultimately more harmful, somewhat helpful, according to the ACP peer-reviewed evidence-based guidance statement number 1 and the famous ECHO trial. If the medicine or insulin dose depends on the blood glucose reading, then the reading should be correct to determine it. Measuring fasting blood glucose is an old way which is misleading and varies on an individual's distinct habits. The new way is average blood glucose reading, which is most accurate and widely accepted by the American College of Physicians and their researchers. If your blood glucose reading is taken correctly, you might find yourself one of the lucky person among 70% type 2 diabetes people, which means you could turn into non-diabetes and you could save your resources, time and efforts from being wasted. Discovery number 3. In home settings, blood samples taken from the capillary blood or fingertip for a blood glucose reading. As you already know from my explanation earlier, that capillaries are the exchange point. They are in just between the arteries and veins. Through capillaries, all the cells of the body exchange nutrients, gases, waste, and many other necessary things. That's why the capillary blood factor is essential to consider while blood samples taken from the fingertips. Because of the whole diagnosis or medicine and insulin dose depends on the reading, that's why measuring blood glucose by samples taken from the fingertip, capillary blood factors needs to be considered. It is that the blood glucose level varies from day to day, hour to hour, even though the patient is on the same diet due to any physical or emotional stress triggers the release of hormone that cause the high blood glucose levels. For women, menstruation and menopause cause hormonal changes that affect blood glucose levels. Regular blood glucose testing will expose patterns and help you to understand this. That's why good or whatever brand the glucometer may be, 10-20% error is an acceptable limit. So it is advised by the American College of Physicians and their researchers not to over-depend on the blood glucose reading over your feelings. You should ask yourself question, how do you feel? You can experiment by taking blood samples from all 10 fingers will give you 10 different readings in the same glucometer. Similarly, by taking 2 glucometers with the same blood samples from the same fingertip, the reading in both glucometers will be different. What is essential is not to over-depend on the glucometer reading, which is old way, and the new way is how you are feeling. Discovery number 4. Blood samples taken from the right or left arm vein or the back of your palm. It is also very imperative that even blood samples taken from the right or left arm vein or from the back of your palm to consider the following 5 important factors are very crucial for accurate blood glucose readings. Winter factor. In winters, the blood glucose tends to increase. That's because when snow, ice, and cold weather keeps you inside, you may exercise less and eat more. Age factor. As you grow, the threshold of blood glucose and blood pressure tends to increase. Fever or infection factor. Whenever you have a fever or infection, the blood glucose increases to help the white blood cells with more energy to fight against the infection. Therefore, it is advisable not to worry and start taking medicine or insulin, because as the fever or infection becomes routine, so does the blood glucose. Medicines that decreases in blood glucose: aspirin, beta blockers, also known as beta adrenergic blocking agent, angiotensin converting enzyme inhibitors or ACE inhibitors, calcium supplements, and anabolic steroids. Medicine that increases in blood glucose: diuretics, epinephrine, cold or cough medicine, thyroid medicine, antidepressant. Not considering the above mentioned 5 factors is the old way to do it, and the new way is to consider these above 5 factors for accurate blood glucose report. If you take your blood glucose reading accurately, you may find that you do not have diabetes, or you are taking medicine unknowingly to become an actual diabetes. You are here because of you probably want to lower blood glucose level naturally in just 1 week, reduce insulin resistance, thus recover from type 2 diabetes. And you now know that management of the blood glucose level by medicine or insulin is not a permanent solution. I have shown you the 4 new ACP peer-reviewed evidence-based guidance statements that how using medicine or insulin to lower high blood glucose level is actually harmful rather beneficial, and the 4 discoveries. Now I will show you the 4-step blueprint or process to lower blood glucose levels naturally in just 1 week, reduce insulin resistance, thus recover from type 2 diabetes. Even everything else you have tried has failed. And we have seen that the old way of doing things and going it all alone is not cutting it. That the only smart way forward is by using the right diet that naturally lower blood glucose level.
They immediately put me on insulin. The thought of me sticking myself with a needle was beyond my belief. Having to take medication in general is just a bore. It's something you have to keep at your hip all the time. You can't leave home without it. I thought I would never be able to get rid of type 2 diabetes. I thought I was going to be a slave to insulin for the rest of my life. I started the program in June. And I've been on the program for 5 months, and I've lost 41 pounds. And after 3 weeks on the program, I was completely off insulin. I don't wake up tired, sluggish. I look forward to my day. I have way more energy, and I do more things. I get things done now. I have 5 grandchildren. But I can keep up with them. I can take them to the park. So my energy level is just like through the roof. I've learned a new way of thinking and a new way of living. I look at food completely different. And I never want to go back to that box of pills that I had before. I feel like a new person. I'm really happy with how I look, how I feel. I love the way my life is now.
I was diagnosed with diabetes in 2000. They kept telling me I was insulin resistant, and it got so bad that I couldn't keep it under control that I was on U500 insulin, which is 5 times stronger, I think is how they explained it to me. A lot of the experimental drugs I took were $200 or $300 a month as well, so I was easily $2,000 a month. My endocrinologist suggested that it was time to get an insulin pump. It had to be something better than pumping a constant stream of insulin in me. My A1C, I believe in October, just before I started the program, was 10.2. I had dropped down into 5 point something. By February, that's just a few months. I go to a heart specialist once a year, and he was leery at first, and we cut my medication in half there. He actually said, "You're doing good, let's cut that down." My kidney guy has pulled out all the pills.
You can do this. We can do this together. Your brighter future is within your grasp. Just imagine how great it will feel when you finally no longer have to struggle with unstable blood glucose levels all the time, increased thirst, excessive hungriness, frequent urination, fatigue, depression, unexplained weight gain, cravings to eat throughout the day, many health complications, unhealed cuts and wounds, tingling, numbness or pain in the fingers or toe, the side effects of medicines or insulin. Feel how good it feels when you get lower blood glucose naturally in just 1 week, reduce insulin resistance, thus recover from type 2 diabetes. And if you would like me to help you to do this, I would be delighted. Here is precisely how I can help you. My expert team and I have set aside some time in the next 48 hours to speak with you about how you can apply these strategies to your life starting today. On this 30 minutes call, we will craft together a specific action plan according to your situation, how to lower your blood glucose level naturally in just 1 week. So if you want to lower your blood glucose level naturally in just 1 week, reduce insulin resistance, thus recover from type 2 diabetes, if you want to be more healthy, happier in your life and in your family life, and if you want to do it all without overhauling your life, then this is for you. Here is precisely how we will do this together. First, we will assess and consider factors that are currently affecting you to achieve the goal. Then we will explore what are those possible roadblocks that are holding you back, if any, and how to overcome them to achieve your goal by crafting an action plan together according to your specific needs. And finally, we will walk with you step by step with everyday accountability to ensure the results. The best part is this call is pitched free as a gift, as I mentioned earlier. And here is why this call is free. Normally, I charge $150 for an hour of my time. But the reason I offer this free call is because I truly enjoy connecting with motivated action takers like you. And I believe it is the only true way to start a relationship on the right foot. And the other reason I offer this call for free is because I know a good percentage of people I speak with will want to work with me to truly meet their goals. And if you find the plan I put together helpful for you and want to work together thereafter, then I can tell you more about my type 2 diabetes natural reversal program. It is not cheap, but it is also not overly expensive, and it is certainly a lot less than trying to do things on your own and continuing to struggle. And if you are not a good fit, there is no hard feelings, nothing to hold back or whatsoever, and we will part as friends. This call is not a sales pitch in disguise at all. With that said, please understand that I am not offering you a sales pitch in disguise. I promise not to pressure you or pester you in any way whatsoever. But before we go any further, you need to know that I can't help everyone. This is not for you if you don't believe that type 2 diabetes is reversible. If you tend always to make an excuses and not seriously ready to put efforts to get well from your diabetes, and if you are not really planning on showing up for the call, this is for you. If you believe that type 2 diabetes is reversible, if you are committed to getting well from your diabetes whatever it takes, if you are coachable and action taker, if you are willing to have some skin in the game, and if you want to transform your life with a proven method with expert guidance in step by step. So if you meet my criteria, here is what to do next. Schedule a call with me by simply click the blue button below. Apply now to see if you qualify. There you will be able to grab a time to chat in the next 48 hours. Once your time has been selected, then you will see a form with few questions I would like you to answer. So I have a better idea of where you are at and where you want to go. That way our call together will be as productive as possible. On the call, I will ask you those questionnaires as our standard procedure to determine if I can help you or not, because I do not know anything about your current situation with your type 2 diabetes. I will tell you right away if I cannot help you, and there will be no hard feelings, no fees or whatsoever. But suppose I see I can help you based on your application and based on the answers of those questionnaires. In that case, I will offer you our service. But if we failed to get your desired healthy A1C levels, then we will refund your full money upon checking that you have followed our process as we laid out. Or we will give you another opportunity for free of cost to get your desired A1C results. So if you want to get a proper assessment and diagnosis for more crystal clarity where you are at currently, and if you want to know what are those possible roadblocks that are holding you back, if any, and how to overcome them to achieve your goal by crafting an action plan together according to your needs and expert guidance in step by step with everyday accountability to ensure the results, then this is for you. Simply click the blue button below, apply now to see if you qualify. Time is of the essence. Since I only have so much time to do these calls each week, as I do not run a huge call center, this is a first come first serve opportunity. Once these spots fill up, well, they are gone. So if you are serious about reverse type 2 diabetes naturally and you meet my ideal client criteria, then click the blue button below, apply now to see if you qualify while this is still top of your mind. So you really have two choices now. You can continue doing what you have always done, and sadly you will likely get the same results. Or we can jump on the phone and put together a winning action plan that will set you up for success. I have noticed that there are two types of people. The struggler figures out what he or she wants and then asks, how can I do this? Then they spend years trying to crack the code, but it sadly rarely happens. Then there is a smart person who actually succeeds because they figure out what they want and then ask, who can help me to achieve this? Then they find a mentor, a coach, or someone who already paves the path, someone who can help them to get the results so much faster than they ever could on their own. So which type of person are you? As you already know from the earlier part of this training, that due to the glucose when overflowing for a long time in the blood arteries, veins and capillaries, they mostly damage the capillary blood vessels. Capillaries are very tiny than arteries and veins, which are connected to all the cells, tissues or organs of the body. Damaged capillary blood vessels cause organs to lose their functionality due to lack of proper exchange of nutrients, vitamins, minerals, oxygen, carbon dioxide, etc. In diabetes retinopathy, where the high blood glucose overflow damages the light-sensitive tissues at the back of the eyes, which is called retina, caused blurry vision initially, and if continued, the person lost their eyesight. In diabetic nephropathy, having high blood glucose levels damage the part of the kidneys called glomerulus situated inside nephrons, which filters the blood. For some people, this can progress to chronic kidney disease and kidney failure. In diabetic neuropathy or feet nerve damage, over time uncontrolled high blood glucose damages nerves and interfere with their ability to send signals. High blood glucose weakens the wall of the small blood vessels called capillaries that supply the nerves with the necessary oxygen and other nutrients. Nerve damage in the feet or poor blood flow to the feet increase the risk of various foot complications. If left untreated, cuts and blisters can develop serious infections which often heal poorly. These infections may ultimately require toe, feet or leg amputation. Cardiovascular disease. High blood glucose damages the blood vessels and nerves that control the heart and the other blood vessels of the heart. The longer the high glucose overflow, the higher the chances of developing heart disease, stroke, peripheral vascular disease, and coronary artery disease. In adults with type 2 diabetes, the most common cause of death are heart disease and stroke because it affects the heart muscles, causing both systolic and diastolic heart failure. Diabetic dermopathy or skin condition. High blood glucose affects the capillary of the body that supply the skin with the blood and necessary nutrients. Due to lack of proper exchange of necessary nutrients and gases, cause a skin condition called diabetic dermopathy. It appears as scaly patches that are light brown or red, often on the front of the legs. Hearing impairment. High blood glucose contributes to hearing loss in people with type 2 diabetes. It is known that high blood glucose damage the capillary blood vessels throughout the body, including ears. That damage to the auditory nerves cause hearing loss. Vascular dementia. High blood glucose is considered a risk factor for vascular dementia. This type of dementia occurs due to damage that is often caused by reduced or blocked blood flow through the capillary blood vessels to the brain. Depression. Damage resulting from diabetic neuropathy or blocked capillary blood vessels in the brain may contribute to development of depression in people with type 2 diabetes. You can do what you are doing. If you continue doing what you are doing, means using medicine or insulin to lower high blood glucose, then you will end up with more health complications, which is 22% increased death, 36% more cardiovascular related mortality, increased weight gain by 10 kg, and increased fluid retention. According to the new American College of Physicians peer-reviewed evidence-based guidance statement number 1 and the famous ECHO trial. You can read a book. Books are great for information, not for transformation. You can do another course. Surely that courses are excellent. What I notice is that sometimes due to lack of proper accountability, expert guidance in step by step makes a massive difference in the effectiveness of the course and getting the desired results. You can do a workshop. A workshop is an excellent way for someone to learn about a particular subject. But what I often found that people attending the workshop have a broad range of skills, tied to fit everything you want to cover in a single workshop, as well as challenging for hands-on practice, which ultimately compromises with the results of what you're looking. That's why you might see that many people keep doing courses, workshops, but not real improvements noticed. Find another coach. There are many coaches, dietitians and nutritionists. Surely you can find another coach, but you need someone who has done it with conviction, has proven method and can walk with you step by step whenever you need during the process. With that said, the last thing you will do to hire a soccer coach to teach someone ice hockey. You can choose bariatric surgery and or gastric banding. There are many risks, complications and side effects of these two procedures apart from the benefit. That's why people do not like them, as you already know. You can choose a drug acarbose or SGLT2 inhibitor. There are many risks, complications and side effects of these two drugs too apart from the benefits, as you already know from my earlier explanation. That's why people do not like them as well. You can choose ketogenic or low carbs, high fat diet. Carbohydrates help control blood glucose levels, which are particularly crucial for people with type 2 diabetes. A study published in May 2018 in the journal Diabetic Medicine shows that while a keto diet may help control temporarily HbA1c levels, a 3-month average of blood glucose, but the diet may also cause episodes of hypoglycemia, which is a dangerous drop in blood glucose. The keto diet may be effective for a short period of time for certain people with type 2 diabetes, but there is still the risk for hypoglycemia. A study published in September 2016 in the journal Nutrients highlights the importance of whole grains for helping to control weight as well as episodes of high blood glucose. But whole grains are off limits on the ketogenic diet. The basic of the keto diet is achieving ketosis, a natural state in which the body turns to burn fat instead of carbs or glucose for energy. During ketosis, ketones or fat metabolites are released in the blood. People on the keto diet are getting 60 to 80% of their calories from fat, 15 to 30% of their calories from protein, and less than 5 to 10% of their calories from carbs. But the keto diet is not safe for everyone, and it is not recommended as a top diet for people with type 2 diabetes due to the potential medication reactions that can occur, as well as need to take supplements, electrolytes, and track essential micronutrients and macronutrients to best manage the type 2 diabetes. Also, people with kidney damage should not try keto diet because ketones can overwhelm the kidney. Ketones can put stress on the kidneys and possibly give you the kidney stones. Moreover, severe muscle loss is a possible side effect of keto diet. The keto diet can lead to dehydration and loss of electrolytes. Because keto severely limits carbs, you may develop nutrient deficiencies. Bowel problems such as constipation are common on keto diet. Your period on keto diet might undergo some changes, could cause your blood sodium to dip, may lead to high cholesterol and increased risk for heart disease. Thus, keto diet will worsen your type 2 diabetes because high cholesterol, high blood pressure and type 2 diabetes are interconnected. Or you can choose the winner's path, which is to work with us. You will get a proven and battle-tested method that can implement from day one with expert guidance and coach to work with you step by step during the whole process with everyday accountability to make sure that you get the results. You have watched this entire training. You want to lower your blood glucose naturally in just 1 week, reduce insulin resistance, thus recover from type 2 diabetes. And you know you are simply not getting the results you want on your own. So take the advantage of this opportunity now. Simply click the blue button below, apply now to see if you qualify, and let's do this together.